have friend of the show, Steve Grumbine, on. And I don't know if you're familiar with Steve and modern monetary theory. I'm sure you are. And they're always, and for me, I'm like an optimist with this. And I also think you throw everything against the wall and see what sticks. So I support any and all efforts at any and all level to do things that help people. So, but they're very skeptical of the finances with this. And I don't completely understand it. It might be one of those things that I don't ever completely understand. But they don't know that it's possible to do it at a state level financially. What do you say about that?
Well, look, the Canadian government, as an example, has provincially run healthcare programs. They do have the Canada National Health Act, but really that's just a funder into the state programs. The state actually operates the program, has state funding and federal funding. So on a parallel track, the reality is we would need federal funds, and that's what the Medicare waiver process is all about. The money, we're already getting an enormous amount of federal money for our healthcare system. In fact, the United States pays more for health, gets more public money spent for healthcare than any country in the world, which is crazy if you think about it. We're talking about compared to other countries that have single payer. And so we're already putting an enormous amount of money into it. Now, is it complicated? Would it be easy? Of course not. But this is a generational issue. And so the way it would work is that we would have to get Medicare waivers from the federal government so that we can use the federal funds instead of it go and have it come into CalCare. We combine that with state funds. The state and federal funds combined are the majority of healthcare costs already. The other big portion of it are premiums, employer premiums, worker premiums, individual premiums when people buy healthcare on the Covered California ACA exchange or what have you. And that's what we'd be getting rid of, is the cost to the employers and to individuals and to families, and instead have a progressive taxation system so that your healthcare is not attached to whether you're employed or not, whether you have good employment or not. As you know, again, other countries look at us and really justifiably think it's lunacy for us to have healthcare attached to employment. It shouldn't matter. And so is it possible? Yes. Is it easy? No. And so those that are skeptical, I understand it. I get why you'd be skeptical. But I met with the Deputy Secretary of Health and Human Services in DC. We met for over an hour with him and his team. It's absolutely doable. It does not require any additional federal legislation. Right now, the waiver process does allow for states to apply. And what we're trying to do would be eligible for that waiver application process.
That's really cool. Did I have the idea ready that we should have Ash and Gustavo on it and do a show? Do you know who Gustavo Rivera is from? He's your counterpart in New York.
Yeah. And yes, in fact, I met his assembly counterpart, Assemblyman Gottfried, who is considered the godfather of single payer in New York. He actually got elected to the assembly in New York before I was born. In 1971. That's how long he's been there. But he introduced the first single payer bill in the 90s. And now with Senator Rivera, they've introduced a bill that's moving through the legislature there as well. And so, it'd be great to connect with them.
Yeah, I think that would be cool.
Yeah, and I think that there's always the thing that I always take exception with the the MMT groups, the groups that are very much about it has to be done this way. My attitude is, how long do you think it's going to take to build enough momentum to pass single-payer healthcare on Capitol Hill? You happen to be friends with Representative Ro Khanna. I can't even imagine what the conversation is like with somebody like him who supports universal healthcare, has to deal with, even with fellow reps in California who obviously have deep pockets from big pharma and private insurance, and that is a huge problem. I see California or New York or both as basically being, the center points of being able to get this across the finish line, properly funded, and then expanding to the rest of the country, just as it happened in Canada. Would you say that that's the biggest pushback that you get, is this whole concept of, well, we're not having necessarily, the Federal Reserve just put money directly into this. We kind of have to balance the budget. But it seems like the budget is getting balanced. And I think that would speak to, a great segue into the fact that it already has passed a very important committee in order to move forward.
Yeah, so I agree. Look, I mean, and I want to throw Washington State in there as well. I want to give them props. I know there's an effort there too.
Washington.
Yeah, and this is a healthy competition to bring healthcare justice to our community. And the reality is, look, DC can't even get Voting Rights Act legislation passed. And it's not, and I don't say that as a criticism to the Democrats that are trying, but let's be real. Do you really think DC is going to be able to do something of this nature? And at the end of the day, it is the states that have to lead. The states oftentimes lead on environmental issues, on marriage equality. I mean, you need on and on and on cannabis legalization. It hasn't happened federally yet, but a number of states have done it. It will happen federally because states have taken the lead. And so absolutely, I think it's not only possible, I think it's the only way it's going to happen is if a state leads, especially a state the size of California or New York. And, built into our bill is the need to have reserves. And so, yes, we're in a great financial situation right now, close to $50 billion surplus. But that won't always be the case. And so we have to have built-in reserves. And that's another reason why you don't want healthcare attached to employment. Look what happened during COVID. During a pandemic, millions lost their healthcare. It's actually the exact opposite of what you want to see happen during a pandemic, right? And because their healthcare was attached to their employment, they lost their healthcare. And now you're seeing the cases of folks that are surviving COVID with hundreds of thousands of dollars in medical debt. And so, medical debt is the number one reason for family bankruptcies in our country by far. And that's, by the way, after the establishment of the Affordable Care Act. It has not changed. Even with the Affordable Care Act, the ratio of bankruptcies, medical bankruptcies has not changed. So yes, absolutely great that we had the Affordable Care Act to bring access, but it has not created true healthcare for everyone because you're still seeing cost is dictating what kind of healthcare you have, whether you're rationing your medications, rationing other kinds of services. And by the way, you have insurance companies. People say, oh, if the government's going to make the decision. Insurance companies right now are making the decision on what kind of care you get. They're overriding doctors and nurses. And they're the ones telling, their customers, and doctors have to tell them too, when the insurance company says, no, we can't do this treatment that I'm telling you need, to start a GoFundMe account. In the wealthiest state, in the wealthiest nation on earth, it's unconscionable.
Thanks for watching. If you want to support our mission to transform politics into service, please like this video, subscribe, follow us on social media, and consider joining our Patreon, where you'll get early access to our interviews as well as other exclusive content. Links are in the description. Peace out.